walk out of your physician's office into the pharmacist, and that's where you find out what your copay is. And it's just not right. We've got to do a better job.
Providing price transparency is critical to helping the prescriber have a conversation with the patient about, is this drug affordable for you? And also helping the patient understand what are their options so that an appropriate, affordable therapy can be prescribed.
Combining the real-time prescription benefit information with prior authorization information and the ability to do that prior authorization electronically is really transforming the entire physician experience with their patient.
We can now have an informed decision about what therapy they should prescribe, what the cost will be, and if the numbers are too high, what the alternatives are here to make sure that the patient gets what they need to be treated appropriately.
Surescripts has a tremendous number of products and opportunities to support interoperability across the country.
The specific role that Surescripts plays in the care quality community is primarily as a provider of record location services. There are a number of benefits to having record location services available.
Sutter is a large organization across a very diverse part of our country, and our patients are very mobile, they move around a lot, so interoperability ends up being very important to us. So we use the Surescripts National Record Locator Service as a component of our interoperability strategy.
Having a record locator service is very important. Having one that's got a national scope is really important because no matter where you're located, you're always going to be seeing patients at some point who have records elsewhere in the country.
The Surescripts Network Alliance is really critical to pulling together all of the necessary stakeholders to solve some of the greatest pain points we have as an industry.
The Surescripts Network is the dark matter in the healthcare universe. It connects so many various data points better than anyone else and provides information on a contemporaneous basis that all of us can use and all of us need.
The Surescripts Network Alliance helps to articulate the story for us that we've been living since 2001. We as a company actually can't achieve anything without partners all across the network. That's what it's about. It's about bringing the EHRs together with the pharmacies, with the PBMs, with the payers, and trying to tie all of this together and then moving forward in unison so that patients and consumers across the U.S. get the best possible experience.
Pulling this network together not only helps solve the industry problems and makes things better for physicians, but it really gets us to what I think we're all really most passionate about, is how do we get the care best for our patients and how do we get that best patient experience? By bringing all of us together and keeping the patient in mind, we all win when that works.